Hello friends and welcome back to my channel Malik Helps. So today's video we are going to talk about acute leukemia, chronic leukemia, adrenogenital syndrome and CONN syndrome. So I have a quote for you. Today's quote says that you are never late to start studying. So there is nothing like you got late, it's the 6th year, you cannot start right now. There is nothing like that. I myself started in the 6th year and I hope I'm doing well. So let's start with today's video.
Leukemia is basically a type of cancer that affects the blood as well as bone marrow. So it will involve the uncontrolled proliferation of the abnormal white blood cells. So it's basically a cancer which will affect the CBCs of the patient. So let's see what is acute leukemia. Acute leukemia is something the rapid progression with the immature blood cells, and however chronic leukemia is the slower progression with the more mature cells. So let's see a better note for you. A better note is here. So leukemia is cancer of blood plus bone marrow, is a cancer which will affect the blood plus bone marrow. So we will see abnormal WBC changes. However, acute and chronic are different things. So let's say acute will be rapid in progression and chronic will be slower in progression. So acute leukemia is characterized by the immature cells. The immature cells are bands, blasts, promyelocytes, myelocytes, and metamyelocytes. Like if you see the abnormal cells, or let's say premature cells, so you know that in the CBC of the patient there is no use for the premature cells. However, bands can be up to 5% in the CBC of the patient, which is normal, and blast should be 0, myelocytes and metamyelocytes should be 0. Next is chronic leukemia. Chronic leukemia is slow in progression. It will affect the mature cells. Mature cells are neutrophil leukocytes. So I have a trick for it. Never let monkey eat banana. So let's see these cell numbers first of all. So here are the normal ranges of the WBCs. So never let monkey eat banana. Our neutrophils are 40 to 70 normal, which will be elevated in the bacterial infection as well as inflammation. Lymphocytes should be 20 to 40%, which will be elevated, you will see, in the viral infections. Monocytes are 2 to 8% chronic inflammation. Eosinophils are 1 to 4%, which will highlight the allergic reaction or parasitic infections. Basophils are the something which we need for our today's topic. However, you can take a screenshot of it. It's better to remember for the KROK questions. So basophils will be elevated in CML or allergic reaction. So chronic myeloid leukemia, it's the hallmark finding that basophils are 1% is normal, elevated will be chronic myeloid leukemia. We are going to see that very well in the question. So remember about in the acute leukemia, there are immature cells, blast, band, myelo, metamyelio. In the chronic, there will be more mature cells, like never let monkey eat banana. So here is something for you to build up the concept that acute leukemia will be characterized in two parts: acute lymphoid leukemia, acute myeloid leukemia. So ALL affects the children and AML affects the adults. And however, in chronic leukemia, we will see CLL affects the older adults and CML affects the adults, the elderly adults. So here is written for you that we have seen the definition, we have seen acute and chronic. Here is written very well for you. If you want it, you can take a screenshot. That AI something I have made, that AI immature, so acute should be immature. Here is written in that CM. So chronic leukemia will be the cancer of more mature cells. So just so you know, here is a mnemonic for you. And also in our all video today, in all the questions, I have highlighted acute leukemia portion with the black color and chronic lymphoid leukemia with the the acute leukemia with black color and chronic with the red color. So next Okay, first thing we need to know about is symptoms. So symptoms will be fatigue, weakness, frequent infections because there are a problem with the CBC, easy bruising or bleeding because of low platelet count or thrombocytopenia, bone pain because the problem with the bone marrow, and proliferation of the leukemic cells in the bone marrow. So, swollen lymph nodes, we will see neck, armpit, groin, weight loss. Cancer is always providing weight loss to the patient, loss of appetite, often in chronic cases. Fever and night sweats. Night sweat is a character of Hodgkin lymphoma. Also the character of Hodgkin lymphoma. Next, what are the things you should remember? So they are the shadows or bodies given in the question. So let's highlight them. Positive reaction to glycogen, it will be for sure acute lymphoid leukemia. Positive reaction to peroxidase, it will be acute myeloid leukemia for sure. Positive reaction to Sudan, so this is AML for sure. So just remember, for glycogen ALL, for peroxide and Sudan AML. And Gumprich bodies, you will see them in the questions. All of them you will see in the questions. We are going to highlight them right now. So Gumprich shadows, or it says bodies, will be chronic lymphoid leukemia. You can take a screenshot for this one as well if the table is more highlighting part for you. So next is the some mnemonic for you, so that there will be stored in the long-term memories for you. So when blast cells are given, so it is having inverse relation with the acute and chronic thing. So blast, if less than 20 are there, so it will be chronic leukemia. If blast cells are more than 20, then it will be acute leukemia. So blast is having inverse relation with the 20%, the number given in the question. So I hope it is clear. Next is progression and severity. So if you see that rapid progression is there, so condition will be acute. And if you see that slow progression is there, so the severity will be high, which is chronic leukemia. So let's go what is next. And next is some another mnemonic for you. If the myeloids, sir, you have told very well that how to differentiate acute leukemia and chronic leukemia. But if what if in the question we highlighted the acute leukemia, but in the option it is given that it is acute myeloid leukemia or it is acute lymphoid leukemia? So sir, you have to remember this mnemonic. If myeloids are given in the question, which is highlighting part, then it should be myeloid leukemia. Otherwise it is, when myeloid are not given, go with the lymphoid leukemia. So enough mnemonics for you. Basophils, if you just want to remember about today's video or today's topic, highlight thing is basophils will be elevated in the CML. Never let monkey eat banana is another mnemonic for you. So final stuff, how to look at the question. First of all, check about the basophils. If they are elevated, it is chronic lymphoid leukemia for sure. Remember, never let monkey eat banana. So the banana when elevated highlights the chronic myeloid leukemia. All right, blast cells, you know the relation about blast cell. Like if you can check the question, when blast cells are given, you can be sure about the leukemia or the cancer is acute or chronic. Third thing is, you will see the shadows and bodies in the question now. So if any of the shadows or bodies are given in the question, you will be able to solve this thing. So next is progression. You got the relation between progression and severity, so you will be able to diagnose if it is acute or chronic. However, if 4 of these points doesn't help you, so just get back to the concept and definition. So the concept and definition is in the introduction part, so you can remember that very well. So the first patient, you can read the question by pausing the video and try to see what are the highlighting parts. However, the question says, against the background of the angina, the patient developed pain in the tubular bones, generalized enlargement of the lymph nodes, and hepatolineal syndrome, which is liver plus spleen is enlarged. Sternalgia, which is pain in sternum bone. CBCs are very affected. CBCs are severely affected here. You can see the RBCs are low, hemoglobin is low, thrombocytes are low, WBCs are elevated, blast cell. This is what we were looking for in the question, isn't it? So blast cell, first of all, basophils are not given in the question probably. Yeah. So next is blast. So blast are given 87%. So this is it. And you can mark the acute leukemia already. Next is you can read the question very well, but we see that our shadows are here. So first thing we are going to see in the question is, what is it? It is basophils. So basophils are there. Let's see. Basophils, I don't see basophils here. Second point is check the blast cells are probably not given here. Third point is shadows or body. So we got the shadows and we are sure about the chronic lymphoid leukemia. Let's go to next patient. Next patient is 63-year-old. So 63-year-old, first we are going to check the basophils in the question. Basophils are given 3%. So we remember now that 1% is the maximum normal value for the basophils. This is the banana from our mnemonic. So basophils are elevated, you are sure about the chronic myeloid leukemia. However, here is also something given, you know about our blasts mnemonic. And in the corner also I have highlighted the thing. If something is incorrect in my speech, at least you have the written form. Next patient is a 27-year-old man having fatigue, excess sweating. The symptoms we have seen in the introduction portion, so all the profile will be related to those symptoms. However, you can read the profile. Next is so in next question we are going to see the basophil first of all. So according to our trick, how to look at the question. So let's see, where are the basophils? Here are the basophils. So basophils are here. We remember that more than 1% of basophils, what to mark? CML. Let's see the next patient. The next patient is having blah blah complaints. So let's look at what we got. Do we have basophils in the questions? Basophils are not there. Point second, do we have blast in the question? Blasts are there. All right. So okay. Here is the mnemonic for this thing. I wrote it somewhere. Just a second. So one thing to remember here is that sometimes instead of the blast cells, the question will give you lymphoblasts, not the blast directly, but the lymphoblast. So consider that they are also blasts, right? So blast cells are given in this question 70%, and you know the inverse relation, that more than 20 will be the inverse relation. So the condition will be acute there. So there are 70%, it means very severe acute leukemia. I hope you got the point. So remember about it, that if sometimes instead of the blast, the question may give lymphoblasts to you. So get ready for this concept. Next is, let's see some more questions. So first of all, we are going to see in the question if according to our trick, if basophils are there. Let's find them. Basophils are not there. Second point is about the blasts are not there. Third point is shadows and bodies. We got our shadows and bodies, gum-rich bodies. Then we are sure about chronic lymphoid leukemia. Let's see the next patient. What is having in the question? So, basophils elevated, you are sure about CML. Let's see the next patient. Blasts are elevated, so inverse relation with the blast 20, and more than 20 blasts will be the acute lymphoid leukemia. Next question says 82% blasts and some auric rods. If you cannot remember them, you just know about the blast cells. Peroxidase stain was positive. We know about the peroxidase stain as well, that it is for the AML. However, the ML was not given in the question, so it's enough to mark the acute leukemia. 82% blast cells. Let's see the next patient. Next patient is having high basophils. Get ready to mark CML. All right. Just one thing to remember, that do not get confused with CLL and CML. As you know that when the basophils are elevated, you are sure about CML, all right? And when the question has given the shadows and bodies, which shadows we are talking about here? We are talking about the gumprette shadows. So you are sure about CLL. So one more time, you can pause the video and say it with your own speech, that the gumprette shadows are for the CLL, the LL version. So, and basophils when elevated are for the CML version. So I hope it is clear. Let's see the next patient. Next question is a bit atypical, but let's conclude it here. So a lot of things are given in the question, but let's go according to our trick. Do we have basophils here? So basophils are not here. Let's see the next. Blast cells. Okay, blast cells are given here. So if very low blast cells are there, like less than 20, you are going to see the chronic leukemia. So another thing is shadows and bodies, which are not given here. The progression is, let's see the progression in this question, because we haven't talked about progression in any question. So 60-year-old man having fever, significant weight loss. So the progression, there is nothing given in the progression, like the pathology got developed in how many years. However, you will find it in another questions very easily, no problem at all. So the key point in this question is 9% of blasts, which highlights the chronic myeloid leukemia, chronic leukemia. However, the myelocytes are given. So this is what I was talking about. That's when the myelocytes are given in the question, mark about the chronic myeloid leukemia. When they are not given in the question, go with the lymphoid leukemia. However, when I was saying that if you cannot understand in the question, then get back to the concept and definition. So the concept and definition states that the acute leukemia and chronic leukemia, acute is the condition related to the rapid progression, and chronic is related to the slow progression. So, or acute, AI, remember AI, acute is immature cells, and CM, the CM of the area, chronic is the problem with the mature cells. So here in the questions given are blast, promyelocytes, myelocytes, metamyelocytes, eosinophils. A lot of things are given in the question. However, lymphocytes, monocytes, and these also are given in the question. So so this is a bit atypical case, as you can see that even the immature cells are given here and mature cells are also given here. So do not have to be panic. Just remember this case is a bit atypical. So however, we got our 9% of blast in order to remember that it is chronic myeloid leukemia. The main thing in the question is that CML is also known as myelosan. All right, so this is what you have to remember about. Myelosan is something known as chronic myeloid leukemia. So you will be able to detect that this is the case of chronic myeloid leukemia. However, you have to remember that CML is also known as myelosan. Next patient says about 82% of blast, so you know what to mark: acute leukemia. However, you can pause the video and read the whole profile of the question. Next patient says what? Let's see the, when you cannot when you don't want to read the question, you just get back to our mnemonic, like what to look at the question. So first of all, basophils are 1%, which is normal. So next is blasts are 2%, so it means chronic leukemia already. Yeah, so as I have written here as well, never let monkey eat banana when elevated, basophils. So CML. So here are those blasts we were talking about. So let's go next. Next is the question says positive reaction to glycogen. We remember from the definition part that it is acute lymphoblastic leukemia. However, be careful with this question. I was looking for how you will differentiate in this question that it is myeloid leukemia or chronic leukemia. Let's read the question if we get any clue. So 38-year-old patient complains about inertness, subfebrile body temperature, enlargement of lymph nodes, nasal hemorrhage, pain in sternum bone. Objectively, the skin on mucosa are pale, enlarged painless lymph nodes, sternalgia, liver +2, spleen +5, erythrocytes low, hemoglobin low, leukocytes are severely elevated since it is the cancer of the blood cells. Eosinophils just 1%, which is normal. However, let's make some sense here that eosinophils, as we know that 1% is the maximum normal limit for it, so it is maybe closer to elevation because their range starts from 0 to 1%, 0.1 to 1%, so 0.1 will be more normal for us. However, this seems to be a atypical question a bit because you can confuse with the CLL or CML. However, maybe they wouldn't have given in the option about the CLL, so you anyhow go with the CML. But remember this case, guys. Maybe the question is incorrect, or maybe the examiner want to check your skills by something. Or so let's go next. This question we have seen. Next is a case of, so let's see what are given. If basophils are given in the question, no, basophils are not there. Next is blasts are given in the question. Blasts, I don't see blasts are given in the question. Next is shadows or bodies, no kind of shadows and bodies are given in the question. Progression, so progression, 3-year-old pain in the legs, they didn't talk about any progression. Back to concept and definition. Let's read the question together. 3-year-old having pain in the legs, fever and loss of appetite, objectively pain and pale mucosa and skin, hemorrhagic rash, lymph nodes are enlarged, painless, dense, elastic, not matted together, bones and joints, abdomen are painful, liver and spleen are enlarged, hemoglobin low, leukocytes elevated, color index is more. So this anemia is which kind of anemia? If you would have watched my video over the anemia, so it would be very easy for you. So color index when elevated is the megaloblastic anemia. Lymphoblast, okay, I thought they are not given in the question, but here are given lymphoblast. So lymphoblast is 70%, it means the acute leukemia. All right. Yeah, I was talking about color index. Color index when higher than 1 is B12 deficiency anemia or megaloblast deficiency anemia, and color index lower will be the microblastic anemia or nomochromic, what they say, I don't remember now. Next patient in the next case is of acute leukemia, and they are asking about the test required. So immunotyping is the test for acute leukemia. So this is the test required about acute leukemia, and I have highlighted this question in the investigation methods of KROK as well. And if you didn't watch my video over anemia, please watch it. Also, the investigation methods are very important for KROK exam. I have covered all the methods in one video or two video or something. So remember about it. So the test or investigation method for acute leukemia is immunotyping. Let's go next to the CONN syndrome. So CONN syndrome is also known as hyperaldosteronium or primary hyperaldosteronium. So this is a condition characterized by overproduction of aldosterone, a hormone which is produced by the adrenal glands. And these are the electrolyte balance is something main which you are going to see in the question. Symptoms will be hypertension, hypokalemia, metabolic acidosis, elevated pH, and due to the H plus loss. You can read the whole text very well. Here is something written: respiratory rate and BP, you know about it. Sodium and potassium. Sodium is 135 to 145 ml mmol per liter in the body, and potassium is 3.5 to 5.0, or they keeps on fluctuating, guys. They keeps on updating. Every teacher will tell different values of it, so we somehow know about the pathology that ranges are like this. So it can be 3.5 to 5.9 as well, so sometimes different. Also remember about the KROK's treatment is spironolactone for the CONN syndrome. Let's see some patients. Before, let's see some mnemonic. Let's see what should you know of before solving the question. So for CONN syndrome, okay, let's talk about both right now together. In the adrenogenital syndrome, K and Na, in both of them, it is written over there. So let's see. You can take a screenshot, please, because it should be in the long-term memory. It should be in the adrenogenital syndrome. A starts. So K comes first in the letters and Na comes later in the letters. So adrenogenital syndrome is also known as congenital adrenal hyperplasia. CONN syndrome is also known as primary hyperaldosteronism. So as you can see, this is the mnemonic to remember about their values, like how you are going to remember the values, which potassium is low in which one and high in which one. So you remember that in adrenogenital it shows the opposite relation with KNA. So in the CONNs, as you can see with the C, the word C highlights that they both are in the towards reaction, towards relation. So K is low and Na is high in CONN syndrome. I hope you will even remember it after seeing it one time itself. Let's get to the questions. The first patient says, this and this 38-year-old woman, headache, paresthesia, muscle weakness, spasm, thrust, polyuria, fever, respiration is high, pulse is high, BP is high, ST depression in the ECG show, potassium low in which one? Potassium is low in CONN syndrome. And another thing which they say, potassium is low and sodium is high. So you got what to mark. Potassium is low and sodium is high. So this is it with this question. Next question is let's get to the sodium and potassium findings first. Next question is saying about K is 3.1. So you know that 3.1 is a bit lower, and sodium is 165, which is a bit higher. So sodium higher, potassium low. You know what to mark in the question. However, you can read the whole question. And why to highlight this thing, that CONN syndrome is also known as primary hyperaldosteronism, because this time the question didn't give in the bracket. The question only gave the option as primary hyperaldosteronism. So remember that CONN syndrome is also known as primary hyperaldosteronism. Let's move next. Next is adrenogenital syndrome, which is congenital adrenal hyperplasia. And this one screenshot is going to make your all of questions easier in the KROK exam. So it is something which is group of genetic disorders that affect the adrenal gland and ability to produce hormones, particularly the cortisol. So let's see some symptoms in infant, children, and adults. So the symptoms are highlighted differently. In the children, we are going to see female born with external genitalia. Okay, salt wasting because of low aldosterone levels. In children, we will see early onset of puberty, rapid growth but reduced final height. Adult symptoms in females, we will see excessive hair growth, like the beard growth or something like that, acne, amenorrhea, and infertility. Males will face the infertility as well as increased muscle mass. Let's see the case. Just remember about our mnemonic. This is a bit something which you need to remember about it, that abnormal structure of the child's external genitalia, hypertrophy of the clitoris, enlarged fascia that resembles the scrotum. Additionally, the child exhibits the accelerated growth as well, the growth of axillary and pubic hairs, and lowering of the vocal tremors. So see the symptoms and catch them through the adrenogenital syndrome. So they are asking about the investigation this time. So examination necessary to confirm the diagnosis for the adrenogenital syndrome is, this is measuring the 17-OH progesterone level in the bloodstream plus 17 ketosteroids excretion rate with urine. So this you have to remember about this. Next is another question over CONN syndrome. So as you can see in the question, potassium is 2, which is low here, sodium is 160, which is high here, and I hope I have provided you the data of sodium and potassium in some corner. So, and another thing to remember in this question is there was no option like CONN syndrome in the question. The option was aldosteroma. So you remember what it is? Aldosteroma or primary hyperaldosteroma or aldosteronium, all of the things are CONN syndrome. I have given something here. Let's see it better way, like this way. So a medulla part secretes this is the photo showing adrenal gland. So the medulla part of adrenal gland shows epinephrine and releases epinephrine and non-epinephrine, and it is more prone for pheochromocytoma or medulla region. The medulla region, when gets problematic or uncontrolled division, is pheochromocytoma. The cortex part releases the cortisol, aldosterone and androgens, which is more prone for the aldosteroma, the cortex part. So next patient is 62-year-old, highlighting about this much of lymphocytes. So you can suspect the cancer of the white blood cells, right? WBCs are 64 in number. Just it's like 7 to 8 times more than the normal ranges. So it is severe cancer. So you can suspect the leukemia in this question. However, the question is asking about the diagnosis. What diagnostic method you will use? So this is bone marrow aspiration. Myelogram is also known as bone marrow aspiration. Since the problem with all the groups, all the cells here, the CBC reports are elevated. So we will do the bone marrow aspiration. Next question, I have told you about the CONS treatment in first video. So CONS treatment will be spironolactone. So it's a mineralocorticoid receptor against agonist, which blocks the effect of aldosterone. So if we will be able to block the effect of aldosterone, then the problem is solved.
So this is it with this video. I hope the leukemia and all the syndromes in the video are clear to you. If there is something, let me know in the comment box, and I hope you are taking enough break from the study session, which is important for you. So I see you in the next video. Have a nice day.